Hi, Kylie and I are here to present oral care and stroke. These are the objectives that we have, and they can be read on the presentation. We are going to talk about the description and definition of oral care. And so that is the practice of keeping the mouth clean and free of disease by regular brushing of the teeth, related structures, and cleaning between the teeth. This enables the individual to eat, speak, socialize without any active diseases, discomfort, or embarrassment. So the World Health Organization defines oral care and oral hygiene as a state of being free from chronic mouth pain, facial pain, oral and throat cancer, infections, sores, gum diseases, tooth decay, tooth loss, and other diseases of the mouth that limit biting, chewing, smiling, speaking, and psychosocial well-being. Oral key is a health indicator of overall health and quality of life. And this is description of basic oral care, and I'm not going to read through all of these because, again, they're on the presentation, but a key aspect of basic oral care is to brush your teeth twice daily, floss. You can floss 1 to 2 times a day. A very key aspect of oral care that a lot of people forget is brushing your teeth, which host a lot of bacteria. Brushing your tongue that hosts a lot of bacteria, and not smoking, visiting the dentist 2 times a year. This is so important just for preventative care, just to make sure no one has cavities. And then monitor your medications that cause dry mouth and just know which ones cause dry mouth, and then you can take other interventions to assist with that. Seek help if gums are swollen, bleeding, if you're losing teeth, if you have chronic bad breath, if it's painful to chew, or you're experiencing extreme sensitivity. This can all lead to letting you know that something's wrong and that you need help getting your teeth and oral health assisted with. And so a description of oral care, which is continued, it is essential for physiologic functions. With our teeth, we chew, we eat, within our mouth we talk, and we communicate with people, and our mouth is our protection. So we all need to make sure it's safe and taken care of. We also want to limit periodontal disease and chronic diseases. So with people with stroke and cardiovascular diseases, diabetes, respiratory diseases, we all want to make sure that those individuals have top of the line oral care, just to make sure that this decreases anything that could potentially go wrong along with having these other chronic diseases and illnesses. Protocols can be followed with oral care. I'm sure that the dentist implements some. We found some research that has a lot to do with protocols. Although it wasn't finished research, there is a lot of research out there that can be done with them. And then over here we have this quality of life picture. It just shows a continuum between quality of life and the aging process and chronic disease, and how oral health and care does play a huge part of this quality of life. And then I'm going to talk about reasoning for oral care education. So this is a huge slide. Advocacy for OT, prevention of diminished function, interprofessional communication, and health promotion, and overall health and quality of life. Oral care is an occupation. We brush our teeth, we take care of our teeth, we floss, we remove our dentures, we clean our dentures. Education on the importance of completing and creating aspects of oral care routine prevents the onset of diseases. So OTs can focus on specific interventions to enable positive outcomes for these individuals. We can assist with implementing a schedule. And then to move on, we can also promote oral care and oral hygiene on a care plan team. We can allow the clients to achieve their maximum level of function if we work with our other professionals on the team and allow them to understand the importance of oral care. And then when we educate them on oral care, it makes them feel more confident and competent, and they're more than likely going to have a positive experiences and assist individuals with completing oral care tasks that may need assistance, which allows them a better quality of life at the end of the day.
So what is the benefit of an occupational therapist administering an oral care program to clients post-stroke? The benefits include it's going to reduce the risk of aspiration and pneumonia, improve socialization, improve quality of life, enable client to perform oral care with skilled setup if they can't independently, or promote independence. It's going to increase self-esteem, decrease overall pain, decrease that risk of infection, promote active range of motion in the upper extremities through utilizing them to participate in oral care. These are just a few of the many benefits an occupational therapy oral care program can provide. So what's the connection between occupational therapy and stroke? Occupational therapy looks at what is the deficit between my client that's just had a stroke and why can't they perform their oral care. We look at those component skills and we provide the solutions to enable that participation of oral care once more. We can help with things like decreased motor function, the lack of cognition that they may experience, the decreased coordination, the decreased sensation. We look at these problems and we can provide interventions, compensatory strategies, and education to help increase that participation. Just to name a few would be a build-up handle for a toothbrush. If it's decreased grip strength, that's the problem. Reducing the use of mouthwash if they're at a risk for aspiration. We can also provide different positioning and setup, put in all the oral care items in one space. We can use different sequencing techniques. We can look at the problem and help create a solution to enable participation in oral care. And that's occupational therapy skill, and that's our connection. The first study is an oral hygiene training program that was twice a day for 6 months. First group was given a toothbrush as well as education. The second group was given an electric toothbrush, mouthwash, as well as education post-stroke. And the latter group is who had the most improved outcomes of oral hygiene. The hospital staff as well as a dental assistant is who administered the oral care in the study. There was a home-based caregiver training program was our second study that was twice a day for 2 minutes for 2 months. The first group of caregivers were given educational intervention strategies such as a pamphlet. The second group was given physical assessments, education, and prevention strategies. The latter group showed the better outcomes for oral care. The third program was an oral care and long-term intervention that was weekly for 3 months. One group received education on brushing, re-education, guiding and tactile cues, while the second group received a placebo effect. The first group received the better outcomes in oral care. So we're seeing a trend of the more intervention that's well encompassing, the better the results. The fourth study was an oral health promotion study. The first group received oral hygiene instruction. The second group received oral hygiene instruction plus a mouthwash to implement twice a day. The third group received oral hygiene instruction, a mouthwash, and physical assistance with their brushing for 2 weeks. The group that received all of the interventions that I just named had the improved outcomes for oral care health. That was administered by a dentist as well as an occupational therapist. The fifth program was an oral health program on health, intake, and nutrition that was 3 times a week for 3 weeks. The first group received brushing and sponge cleaning twice a day as well as instructions on eating. The second group received the same as the first plus 30 minutes of oral care, health, and swallowing training. This second group received the better outcomes. The sixth and final group was a protocol that was administered, a 2-hour talk, a 3-hour lab to unit staff that was on why oral care is important, and this is still being done today. Our proposed program is rooted in evidence. Our materials consist of an electric toothbrush, a build-up grip handle for a toothbrush as needed if the client has decreased grip strength, mouthwash, sink, toothpaste, etc. The frequency is twice a day. The OT implement in morning and caregiver or nursing would follow up in the evening. The duration is 6 weeks, twice a day, 2 minutes of toothbrushing per time, and 30 seconds of mouthwash. The location would be in a long-term care facility. The objective is to create a comprehensive daily oral care routine because that is what was most effective in the evidence. So we're going to include that electric toothbrush, that mouthwash, and education, but not just pamphlets. We're going to include tactile education, positioning, setup, and we're going to do that daily rather than just once a week. That's what we believe would be most effective, is a combination of those three and the education that OTs provide rather than just an informative handout. That's what we created based upon the evidence. Here's our references. Thank you.